When we talk about a serious medical diagnosis, our minds usually jump to the physical side of things, the treatments, the doctor's visits, the recovery, but there is this whole other journey happening at the same time, one that's often invisible. So today, let's talk about the psychological side of healing. And isn't that the truth? A moment like that, it does so much more than just affect your health. It completely rocks your world, your perspective, your plans for the future, even how you see yourself. It's like a personal earthquake that sends ripples through every part of your life. And that's the big question we're really diving into here. We're going to walk through that emotional path, from the moment of diagnosis all the way to survivorship, and explore the kind of structured support that can honestly make all the difference. So, it all starts right here, that moment the news hits. This first stage is all about just trying to process the initial shock and the huge emotional wave that comes with it. This is so much more than just hearing some bad news. It's about trying to find your footing when it feels like the floor has just completely dropped out from under you. And this is that critical first step where psychological care can really help you navigate that first blast of fear and uncertainty. And this support isn't for just one type of person or one specific moment. It's designed for so many different experiences. Whether you literally just got the diagnosis, you're deep in the stress of treatments, or you're a survivor figuring out what life looks like now, there's support for every single one of those stages.
Okay, so let's move into the next phase, the treatment itself. This part of the journey brings its own, very unique and intense set of challenges that go right alongside the physical fight.
This really lays it out perfectly. It's like you're fighting a battle on two fronts at the same time. On one side, you've got all the physical stuff, the side effects, the exhaustion. But on the other, there's this invisible emotional battle, the anxiety, the stress on your relationships. Both are just as real and just as exhausting.
And this is so important to get. The fear, the sadness, the stress, these aren't just little side effects you're supposed to push through. No way. They are completely valid emotional responses, and they absolutely deserve professional care and attention.
So, how does this kind of support actually work? Well, the idea is to be holistic, which is just a way of saying it's designed to treat the whole you, your mind and your body together, using proven, evidence-based methods.
This table breaks it down really nicely. It's not a one-size-fits-all kind of deal. For example, if you're dealing with a ton of anxiety, something like therapeutic counseling, using approaches like CBT or cognitive behavioral therapy, can give you real practical tools to manage those tough thoughts. If your relationships are feeling the strain, couples therapy might be the key. The whole point is that the care is tailored specifically for you.
And what about when the treatment is finally over? You might think that's the end of the story, but for so many, the emotional journey is actually far from done. Life as a survivor brings its own whole new landscape of feelings and challenges. And this chart gives you a pretty clear picture of what that landscape can look like. That fear of the illness coming back, it can be a constant worry. Then there's the whole challenge of finding a new normal when your old life feels like it's a million miles away. These feelings aren't just common, they are totally expected. Which leads to a question a lot of survivors ask, sometimes quietly to themselves: what if I'm supposed to be better, but I still don't feel okay? And the answer is a huge, resounding yes, of course. Healing is not a straight line. It's totally normal for fear and anxiety to stick around, and there is absolutely support available to help you find your peace and your purpose again. The main thing to know is you are not alone in this feeling. Okay, so knowing you might need some help is one thing, but actually taking that first step can feel pretty huge. So let's break down how you actually go about getting that support. Now, here's a really practical question you might have. An illness doesn't just happen to one person in a vacuum, right? It affects the whole family. So can they be part of this healing process too? Yes, absolutely. In fact, including your partner or family can be a total game changer. It helps everyone get on the same page, helps them understand what you're going through, and gives the whole family tools to support each other. It just helps lighten the load for everyone. And getting started is way simpler than you might think. Really, step one is just admitting to yourself that you don't have to do this alone. From there, you can just reach out and ask questions, no pressure, no commitment. And here's the really important part: you don't need a referral from a doctor to book a session. You are in the driver's seat. The whole system is really built around what you need. It's completely private and culturally sensitive. You get to work with specialists who really get this stuff. And with options for individual sessions, couple sessions, family sessions, and even online therapy, you can find a way to get support that actually works for you.
Look, if you take away just one single thing from all of this, let it be this. Your emotional health is not an afterthought, it's not a nice to have, it is an absolutely essential part of your healing.
At the end of the day, seeking support isn't about admitting weakness. It's about honoring everything you've been through, honoring your incredible strength, while also holding a safe space for your vulnerability. Because true, deep healing means taking care of the whole person,